Everybody. And it is my great pleasure to extend you a warm welcome to our webinar on digital health transformation in Europe, raising the voice of nurses and midwives. My name is Mervi Jokinen, and I am the president of the European Forum of National Nurses and Midwives Association, EFMA. And this is actually our first webinar for 2024, and it's based on the series of webinars we run through 22-23, implementing the global strategic directions of nursing and midwifery in the European region. Now, our partners, WHO European Region, European Federation of Nurses, EFN, and the Early Career Nurses and Nursing Students Association, ENSA, are joined today by the Euro scholars of the ICN Global Nursing Institute, GNLI, to bring you to discussions on the latest policies, strategies, and best practice in optimizing the integration of digital health into all environments of healthcare delivery. Now, we have been able to build a program for this webinar with several expert speakers, so thank you for those in advance, looking at where we are and where we should be in the direction in the world of digital health. This is a very broad topic, and I'm sure in the future there will be further webinars to take sections of the digital health topic, to make sure that the service and the practice are fit for purpose. I'm sure, actually, are you aware that today is the World Day of Books? And of course, we are on the eve of the Women's Health Day. So happy both days to everybody. And we of course know how improving the health literacy is an important factor in reducing inequality in health, and the digital health is bringing solutions to communicate, interact, and educate our diverse population. Now, before I bring our excellent speakers, can I just remind you that we have translators, interpreters for this session, the whole webinar. So you will have a navigation button on a globe where you can choose the language of your native language that you're going to listen by, because we do have a broad section of speakers from all over the European region. And now I will invite Maggie Langins, the WHO Policy Advisor in Nursing and Midwifery, to take the floor. But just to mention that after Maggie, our in-house excellent moderator for EFMA, Vice President Karen Pioro, is going to take over. So I hope you enjoy the webinar, and as always, be interactive and send us messages how you actually appreciate our program. Thank you.
Thank you, Mervi, and good afternoon, everybody. I think it's evening in parts of our European region, which represents 53 countries. It is a real pleasure to be here at this ongoing webinar series that we are very pleased to co-host with the leadership from EFNMA, but also partnership with the European Nursing Students Association and the European Federation of Nurses. So welcome, everybody. Before I introduce my esteemed colleague, Dr. David Novillo, who is the Regional Advisor of Digital Health here at WHO Europe, I do want to call everyone's attention to the strong commitment that the Nursing and Midwifery Program and our larger health workforce and service delivery program have in working together with our colleagues in digital health. Digital health is obviously an enabler of our service delivery, but it's also an enabler for our health workforce and our nurses and midwives. It should not be a burden on our health workers, but rather our health workers should be very much engaged with the design, the development, the use of digital tools so that their work can be optimized, it can be improved, and even their health and well-being can be improved. I also want to remind everyone that 2 years ago, when I took the position of Nursing and Midwifery Policy Advisor, we had, if everyone can see, the roadmap for implementing the global strategic directions on nursing and midwifery. And if you consult this on our webpage, which I will put the link in the chat box, you will see that we have several action items that relate to digital health. So, for example, when it comes to education, we really want to make sure that we're using digital tools for education, whether it be initial education of nurses and midwives or continuing professional development, but also that we want to make sure that our policy leaders, our government chief nursing officers are able to use digital tools to guide the development of digital tools in our health system, and that digital platforms are used to support the health and well-being of our health and care workforce. As we will see in our discussion, and I'm very pleased to share an example from Uzbekistan today, we have a government chief nursing officer who has been instrumental in developing new service models in Uzbekistan that are led by nurses, but also hinge on their use of digital tools and digital technologies. So a very warm welcome to our government chief nursing officer, Dr. Riksi Salikosayeva. But also when it comes to jobs, with service delivery, it's important that nurses and midwives are able to access the same records as our other health professionals are using so that we can better integrate and create multidisciplinary models of care, and that resources that help nurses and midwives' clinical decision-making are available to them at their fingertips with digital tools. So those are some of the action areas that we hope that will draw your attention in the roadmap, and also that you're all working towards as associations that represent nurses and midwives. So with no further ado, I think, Karen, is it okay to sort of hand off to my colleague, Dr. David Novillo? Really wonderful to have another WHO colleague join us, because we never work in isolation here at the WHO Regional Office for Europe. And it's really my pleasure to invite the regional advisor on digital health to speak about our overarching approach to digital health. David, the floor is yours.
Thank you so much, Maggie, for this opportunity. As you said, it's great to have the opportunity to work and learn from you, and to have this work together to move this agenda forward. So I will briefly present, colleagues, an overview of the digital health plans for the WHO European region, and then I will mention something related to health workforce with a focus on nurses. I don't know if the presentation is already set, Maggie, or... Super, I can see it now.
Do you see it?
Not in full screen mode, but I can see it.
Okay.
So if the colleagues are fine with that, it's also fine with me. So yeah, I can see it now. Yeah. Super.
And
very
you
good.
Can see it full. You can see it full mode, right?
Yes. Yeah, it's fine to me now. Thanks a lot. So, so colleagues, so next slide, please. So very quickly, I'm just going to go through some basic background about the rationale for having a WHO digital health action plan on digital health, also about some points related to the action plan itself, and then a third part related to the health workforce in particular. And as I said, I won't speak for more than 10 minutes, and it will be a very brief presentation. So moving to the background, the next slide, please. What are the rationale for us to have this action plan? So there will be 2 slides about this. The first one is about the EPW, the European Program of Work for the period 2020-2025. Digital health was highlighted as one of the main flagships for the WHO European region, and that was one of the strong arguments for us to have a digital health action plan. Then another reason for having a European action plan is the global digital health strategy that was approved in 2019. It's a plan that is coming to an end next year, that it will be renewed. So for us, this action plan is actually the operationalization at the regional level. Then there are two more relevant documents about this as part of the context. A document that was produced during the pandemic about the landscape analysis and the disruption of digital health solutions when talking about to address the COVID-19 pandemic. And then the Pan-European Commission, that I'm sure that you're aware of with that, and also the importance of particularly strengthening data through digital means. The next slide, please. About also the reasons for us to have this strategy. First, we are covering almost 1 billion population in our region, 53 countries. We know that this is a diverse region with different health situation and digital trends. We have very good connectivity, particularly in EU countries, but then we go to non-EU countries, the situation is not the same for all of them. Also, we saw, as I said, the importance of the disruption of digital solutions during the COVID-19 pandemic. But also we saw the digital health fever also during the pandemic about the use of digital solutions for this. And for that, I am always criticizing a bit our approach when working on digital solutions, because we are sometimes a bit obsessed with working and investing in digital solutions without a proper governance mechanism that will ensure sustainability. So that is somehow these two slides about the rationale for us to have this action plan. Next slide, please. So for moving forward, considering this context and the background, what we did to reach out to the member states, this XX is actually 37 member states, sorry, but that number is not in the slide. And then you can see that we involve several international partners as part of this effort to produce a regional digital health for the European region. So this was not an isolated effort from WHO, but actually we reached out to more than 10 partners to really ensure that everyone was aligned with our vision and mission about digital health, that is basically to improve the health of the population in the WHO European region. Next slide, please. Very briefly about the 4 strategic objectives of this action plan. The first one related to setting norms, developing technical guidance, and formulating direction. And the reason for having this first strategic objective related to developing norms and technical guidance is that there is a lack of guidance and evidence around digital health. So for us, it was very important to position this point as the first strategic objective, because we cannot move in digital health if we don't have proper technical guidance and direction to move in this direction. So that is the reason that we put that at the center of the strategy to ensure that we are able to produce enough support to the member states. Also,
David,
the second point.
David, excuse me for stopping you, but many of our speakers are non-English speakers, and if you could slow down, slow down a little bit so they can understand what you're saying.
Yes,
thank you. So
particularly the interpreters. Yeah, sorry for that. Thank you, Karen. Thank you. So the second strategic objective is related to enhancing country capacity and digital health literacy. And for that, the part related to enhancing country capacity is basically the translation of the first strategic objective related to setting norms and technical guidance to then implement this technical guidance in the part related to the member states. Also, as part of this objective, we have the digital health literacy part. According to our last report, that we conducted a survey about the status of digital health in the WHO European region. When asking the member states, our 53 countries, about digital health literacy, we found out that only a half of our region, 52% of our countries in the European region, has a digital health literacy plan. And for us, this is a real red flag for the region, because we know that all the countries, without exception, are investing in digital health solutions, but the part related to ensure that the health workforce is able and capable to work in this ecosystem, digital ecosystem, but also the population is also prepared for managing these digital solutions, is lacking. So that is the reason that for us also digital health literacy is a top priority. We know also as part of digital health literacy the importance of involving the health workforce and the population when developing digital solutions. And sometimes that is also a risk when we don't do that, because then that means that we are putting solutions that have not been actually built for the purpose of the health workforce and the population. The third strategic objective is related to building networks and promoting dialogue and facilitating knowledge exchange. And for that, as I said at the beginning of this slide, we know the lack of guidance and technical norms around digital health, and also we miss a lack of global and regional network around digital health, particularly in this area of work, and as in any other public health area. It's important that we work together, not in isolation, and we have the capacity to facilitate this knowledge exchange and to provide these good practices across the European region. So for that, we have established a strategic partner initiative on data and digital health that will help us to put the public and the private sector to work together to really expedite the digital health agenda across the European region. And the final strategic objective is about conducting horizontal scanning and landscape analysis. That is basically to ensure that first, we are evaluating and monitoring what we are doing on digital health, but also take stock of new advancements. We have seen recently the expedition of the use of the AI, generative AI. So we are also putting an eye on all these new disruptive technologies that will have a direct impact in public health. So again, just to briefly wrapping up this slide, setting down some technical guidance because there is a lack, implementing this guidance in the countries, strengthening the collaboration at the global level with the countries and international organizations, and then to take stock and monitor what has been done. And next slide, please. And just the last slide, and with this I am concluding, just to mention two studies that we have conducted around the impact of digital health in the health workforce. So the first one that on the left, that was published in The Lancet, shows that the use of mobile technologies, telemedicine, and other digital tools intended to support clinical decisions, improving health workforce performance and mental health, and also the skills and the competencies. So this was one of the findings of this study. Also, this study shows that health and care workers who use digital health technology report increased accuracy and efficacy during decision-making processes, commonly facing clinical practice, reduced time needed to execute tasks, improve productivity, increase access to reliable real-time data, etc., etc. So I will definitely, for the impact of digital solutions, I will advise you to look at this study, and we'll be happy to provide you more information if needed. And the final study that was published in Nature showed that better training programs, incentives, and evaluations of perceived technology usefulness could increase the adoption of digital health tools among the health workforce. So we know that there is a positive impact about digital solutions, but also we know that there is several barriers that we need to address. And we look forward to work closely with you to work on these challenges. And with this, thank you so much again, Karen, for slowing me down, because I know that as a good Spaniard, I speak very fast, and looking forward to continue these discussions. Thank you, colleagues.
Shall I take over from here then, Maggie? Thank you. Thank you very much, David Novillo, for this really exciting presentation. And we know that how important it is that WHO Euro really has a motivating role, a standard-setting role, and to push the national governments to invest in digital solutions and to really step up the implementation of good digital solutions that will really support the work of clinicians, leaders in healthcare, researchers, and public health and analysts who provide data to drive the systems. So thank you so much for your presentation today. And we look forward to collaborating with you between FNMA, EFN, the students at ENSA, and thank you very much. And thank you, Maggie, for your presentation. And also thank you, Mervy, for your introductory statement there. My name is Karen Bureau, and I am the chair of the webinar organizing committee. This is the 7th webinar that we are holding together. Actually, I think it's the 8th, if I remember correctly. Yes, number 8. Wow. I'm also the vice president of the European Forum of National Nurses and Midwives Associations and the second vice president of the International Council of Nurses. So it really gives me great pleasure to welcome all of you who are listening to this webinar. And I can see that we have many out there who are listening to this webinar. So welcome to everyone. I have a co-moderator for this session, and his name is Rolf-André Oxholm, and he is one of the 8 GNLI scholars from the 2021 cohort, and this cohort really did quite a bit of work when it comes to focusing on digital health in the European region. And could you just say hi, Rolf-André?
Hi, hello everyone.
That's very good. And I actually will give the word to you now, Rolf-André, and you can just give a brief presentation of the GNLI project, how you worked on, because we did get the presentation from David Novillo, and this was the policy statement or the policy work that the GNLI actually provided input into before it was adopted by the regional committee of the World Health Organization European region. And this was very important to ensure that nurses and midwives' voice was heard already in front of or ahead of it being adopted by the regional committee. And for those of you who don't know how WHO is organized, we have the World Health Assembly, which includes all the ministers and ministries of health across the world. But we also have the regional committees. And in the European region, we have 53 member states. And once a year in September, all the ministers of health meet together in what is called the regional committee. And they were the ones, these 53, who adopted the action plan that was presented by David Novillo just now. And so ahead of that, there was a lot of work that needed to be done to develop the statement. And nurses and midwives were represented and had an impact on the development of the statement, thanks to the work that the GNLI scholars of 2021 did. So now I'm going to give the word over to Rolf-André. And do you want slides or do you want to just talk?
I have a few slides, but I've never shared my screen on Zoom before, but I think I should be able to.
Go ahead and try. Go ahead and try. Just press share screen.
Yeah. So, and I'm going to get this. Do you see the presentation now?
Yes, we do. Thank you.
Because I don't see you, but that's fine. So hello, my name is Rolf-André Oxholm from the Norwegian Nurses Organization, and I attended, as Karen told you, the ICN Global Nursing Leadership Institute program in 2021-2022, and we were 8 participants in the group from Europe. You can see them all here at the WHO regional office in Copenhagen. The program required us to conduct a regional project focusing on the policy issue that was relevant for the WHO Euro office. Several group members had expertise in digital health, and at the time the regional office was working on the digital health strategy that David Novillo presented just now. And we decided in our group that we wanted to ensure nursing and midwifery input into the strategy to support the WHO Euro roadmap for nursing and midwifery. And Maggie Langins opened doors at the WHO Euro for us. And we had virtual and in-person meetings with Clayton Hamilton, who was in charge of writing up the strategy. And here are the names. As you can see, we are from, well, Britain, Ireland, Portugal, and Norway. The strategy was adopted at the regional committee, which is the assembly of all ministers of health in the WHO Euro region. They meet once a year in September to adopt policy. And our group developed a intervention on behalf of the ICN and FNMA in support of the digital health strategy. And our colleague, Dr. Natasha Phillips, who was the Chief Nursing Informatics Officer of England at the time, read the statement at the regional committee. So what did our statement say? Very briefly, ICN and FNMA strongly supported the regional digital health strategy and believe that digital technologies provide significant opportunities to improve the working lives of nurses and midwives, advance practice, and improve population health. The contribution of nurses and midwives is vital for effective digital transformation. Without it, there is a risk that the accelerated adoption of digital health will have a negative impact on the ability to deliver care and support citizens' health and well-being. We call for nurses and midwives to have a leadership voice and role in the implementation of strategic plans across member states. In addition to this policy statement, we also worked on a literature review. The aim was to investigate whether we, the nurses and midwives, have the knowledge base on digitization in nursing and midwifery to support all 4 areas of the WHO Euro Nursing and Midwife Roadmap. My colleague, Dr. Gillian James, was the lead investigator on the literature review, and she will present the study. And when I manage to stop sharing my screen, you can go ahead, Gillian. There, I think.
Thanks, Andre. Hello everyone, and thank you very much for inviting us to share this work with you today. I have got a small number of slides and a task that I hope I'll be able to enable you all to take part in. So I'd be grateful if you can tell me if you can see the slides.
We can see the slides, Gillian. There you go. Very good. No, it's perfect. Thank you. Brilliant.
Okay. So as I said, thank you to Rolf Andre for that introduction, and it's a pleasure to be here. And I'm Gillian, and I'm presenting on behalf of our 2021 Euro GNLI cohort. And this project, as you've just heard, is one of our outputs from that group. We did manage to secure some funding to support it from the Royal College of Surgeons in Ireland and the ICN. And as you can see from the picture there, which Rolf Andre has actually shared already, that was us in Copenhagen. And I think picture, I think I remember meeting him when we were there. And Maggie, of course, and Clayton Hamilton, who was the digital health flagship lead, who was very instrumental as well. These are the members of our group, and this was the title of an integrative review that we undertook to really look at what was the state of the evidence regarding nurses and midwives' contribution to leading digital health policy and practice. So we were very much trying to have the focus on leadership rather than necessarily leadership and development of digital health policy, tools, practice, rather than implementation or practice or implementation of that policy per se. So today, obviously, I'm focusing very much on the results of this review. The aim is here for you to see, but the full methodology and process of what we've gone through is in the published protocol, and there's a link there for you onto the site where you can access that protocol. I'll obviously provide any more information for anyone that wants it, but the methodology is not our focus today. We do have a paper that is under revision for Journal of Advanced Nursing, so all being well, that will be out around April time. And again, if anyone's interested, please just get in touch. I'll keep an eye open for that. So this is the risky bit of my presentation. I wanted some engagement, involvement from everyone. We've structured the discussion, particularly of the review and the findings from the review, around the 4 domains of the global strategic directions for nursing and midwifery that Maggie mentioned. And And I would like you just to all engage, if possible now, in a quick quiz, one question. And I would like you to rank the four domains in terms of from highest to least. Which of the domains do you think most evidence around? So in this review that we've done, have we found the most evidence that relates to jobs or education or service delivery? And have we found the least, that, you know, which of those domains have we found the least evidence for? Now, I don't think this next slide is going to work. So I did have something ready in the chat, ready to press, and now I can't see it. So I'm just going to end the slideshow so that I can send you a link. What you'll need to do is sign into menti.com. I can't see anything now. Sorry, but I'll stop sharing. I just need to be able to see I've put a link in the chat. So if possible, if you follow that link, it should enable you to see a question, which is the same question as you've just seen. So has that worked for anyone? Oh, the slide works. And I can... I tested it before it worked. We tested it in the pre-meet and it didn't work. So now I'm a little bit uncertain as to what's working and where it is. But if it's working, that's brilliant. So what I'll just do is reshare the slides, if that's okay, Karen. And hopefully you'll be able to see the results. Has everyone had a chance to vote? Maggie not. I can see Maggie shaking her head, but I can't see anyone else.
Can you share the QR code again? Because that seemed to sort of work for me.
Okay, hang on.
This link seems to be to your account or something. So we have to log in.
Okay.
It's not the public.
Mine required a login as well. So
yeah. So I think the QR works. Someone else has said so too.
Okay, I will share that again, Maggie. If anyone happens to be at menti.com, there is a code you can just put in, but I will share these slides. What you will see now, if I share the slides, is what everyone else has voted. So you'll have to try and
I think we probably should just move on, though. Unfortunately, not everyone is being able to vote.
That's okay. And actually,
we can relate to the response anyway.
I'll leave it open for later as well. So you will people who haven't had a chance to vote should be able to vote later. So in terms of the wisdom of the crowd from today, then this looks like what we've said. We think that we'll have found the most information on education, second around service delivery, third on leadership, and the least on jobs, which is actually quite interesting. So what did we actually find? Okay, so if I start with service delivery, we did find a lot of evidence. And what I should say is the vast majority of the evidence, although it included grey literature, was assessed as good quality. So we only had 4 of the 22 papers that were included in the review that were quality appraised as low quality. So overall, the quality of the evidence is actually very good. But there are opportunities to improve the evidence, particularly in terms of how digital health supports progression and the meeting of the UN strategic development goals. Lots of evidence that nurses are ideally placed, but they need to be better equipped and there needs to be a better infrastructure, particularly to support their influence of policy, leadership and management. And there are perceived risks around that need to be managed in terms of engagement for nurses, in terms of digital health potentially risks compromising some of the strongly held nursing ideals and linked to patient safety and quality of care. And these are very high level findings, I must say. The wisdom of the crowd was very correct in that the jobs section of the Global Strategic Directions was the clear outlier. There were only 4 of the 22 papers that addressed this topic. It's clear that there's the potential for positive impact on the challenges that we're facing as a workforce, and there are opportunities for new roles, but there's also a lack of recognition around those roles and future career pathways. A very clear role for NNOs and regulatory bodies, particularly around scope of practice, recognition, and those sorts of issues. In terms of education, again, the wisdom of the crowd was correct in that there was a lot of evidence. And what I should say is, apart from jobs, each of the other 3 domains, between 19 and 20 of the 22 papers addressed these domains. So there is quite a lot of evidence apart from the jobs domain. And, you know, supporting the digital patient, digital practice is core to nursing. But actually, we need to move more past competence and into digital capability. And I can talk a bit more about what I mean by that if we have time. And the idea of integrated digital competence is still poorly defined and not widely embedded in nurse education. And finally, leadership. Surprisingly, we had to do with that to pick up anything on leadership. Again, 1920 of the papers addressed the nursing and midwifery leadership of policy around digital health. Explicit, and it wasn't visible. It's poorly defined and theorized. So leadership is poorly defined and theorized in a digital context. But we need digitally capable leaders who can bridge that clinical technical divide, which sort of David alluded to earlier on. And we're still in need of global standards and global leaders that are able to address because there are common challenges across varied levels of digital adoption and maturity between countries and nations. But the challenges are fairly common. So there is joint learning and joint action to be taken there. And that's the end of the presentation. And I'd just like to thank the team that I've been part of, the support we've had from ICN. And following on from the review, we have managed to secure funding for a PhD studentship and have some other work in progress and other developments that we hope to move forward based on the review. So thank you to everyone for listening.
And thank you, Gillian, for this presentation, and thanks to the whole group for really focusing on this really important issue, because it really shows that we need more research really to develop the knowledge base for to say anything about really what digital solutions are effective in nursing practice, for nursing leadership, for nursing education, and also for nurse jobs, you know. So this is really an important study, and we wish you luck, you know, in getting it published. We'll look for that research. I just have a couple of questions for you, Gillian. When you were doing the review, you only were able to include 22 articles, which really isn't a vast number. And that sounds, you know, really quite limited to me. Were you surprised at the limited number of articles you were able to find?
you know, reviews vary by size, but from an academic perspective, that's probably a normal number. So actually we were quite encouraged when we first set out. I mean, what I am going to mention the search strategy because our focus was on nursing and midwifery leadership of digital health and policy. As soon as we put any term to do with leadership into a search strategy, we returned 0, nil, hits. So no papers or documents. So that tells me it's about, and yet when we took that out of the search strategy, we located 22 that were very relevant. So that tells me something about the way nursing and midwifery leadership or literature around policy and leadership around health generally, actually, the way that's presented, it's not highlighting and making visible the nursing and midwifery contribution to the leadership of it. The other thing I didn't state was we were intending to look at any differences or similarities between nursing and midwifery, but there was only one paper that differentiated between those two roles. And I think that is linked to the way that they're used differently internationally. So not all countries differentiate between nurses and midwives, for example. So we have grouped everybody together, for want of a better term.
Well, I guess, you know, if the 22 articles were, you know, of high quality and relevant for your research question, I'm sure that was very encouraging as well. So we look at, you know, what we do have, I guess, and but it also shows that we need more research in this area, so that we have, you know, because really 22 articles, it doesn't give overwhelming support to the global strategic directions for nursing and midwifery, or the regional roadmap for that matter. So that some areas do look like they're still quite thin. Do you concur with that summary that we need more research?
Oh, absolutely. And you know, my head's fizzing with potential research questions and how we could build that evidence. And for me, it's not just what I would call traditional research. It's real time, building the real time evidence as we go along. And as you know, Karen, I'm from an improvement background, so I would take a scientific approach to improvement as we go along, so that we're feeding use the type of research that enables us to feed the findings as we go along into policy, practice development, leadership development.
That's really promising, and congratulations on securing funding for a doctoral research fellowship. So we'll be looking forward to that in the future, and of course we need much more of that. I just have one last comment, and that is the weakest area in that your study showed was that the jobs area of the global strategic directions for nursing and midwifery. So that includes among other things, decent work, decent jobs, and workload. And, you know, considering that tomorrow is March 8th, the International Women's Day, we know there's a huge gender gap in the area of digital health. About 90% of nurses and 98% of midwives are women. Did you see any articles that really address the digital gender gap in your research?
Yes, a very tiny proportion. So what that's meant is that we can't really make a sensible comment on that, other than there is a very tiny proportion. So that is a big gap, very definitely, Karen. And as you say, very topical at the moment, and particularly for the professions that we're talking about. And a big loss, actually, a big loss to the potential for sustainability, for the addressing the strategic development goals as well. And a big opportunity, because if we can do something about it, then the payoff can be even greater.
Yeah. Well, this is wonderful then, and I imagine that your literature review also points out different areas where research questions could be advanced, and so anyone who's on the call today at the webinar, of course, can look at your literature review and see what kind of research questions you have identified there. So once again, thank you so much, and thank you to all of the GNLI scholars who contributed to developing this literature review. And it's definitely a good basis for further work. Thank you, Gillian.
You're welcome, and thank you all.
Yes. So we move on then to our next presentations, I should call them, because the next 5 presentations will focus on each of the 4 areas of the global strategic directions for nursing and midwifery: service delivery, leadership, education, and jobs. And we'll have one speaker who will address each of those specific areas. So first of all, we will have a presentation by Dr. Ann-Christine Rultegård, who is the Managing Director of VAR Healthcare. She will present a digital evidence-based decision support system that includes codes or coding from the International Classification of Nursing Practice codes for nurses and midwives at the bedside. So the floor is yours, Ann-Christine Rultegård.
Yeah, thank you so much. And thank you for having me. It's a pleasure being here and have the opportunity to present kind of a life work from a Norwegian and Scandinavian perspective. VAR Healthcare is about making evidence usable for education as well as for clinical practice and bridging the gaps that are between education and practice as well as research and practice. Let's see, can you see my slides? Yeah, good. Just shortly, I have a background with a PhD in nursing science. I have a candidacy in nursing science in didactics, and I have my background from pediatrics. I have also been working within nursing informatics for around 20 years, and I'm the chair of the International Medical Informatics Association and the Nursing Informatics Group. In VAR Healthcare, I have a group of colleagues that works on this solution, and most of them are well-experienced nurses with high education and a research librarian and some developers, just so you know that this is a system made from a nursing perspective. VAR Healthcare it's one system for the whole continuum of care. It's used in education, in patient care and treatment, in documentation of care. It's used in competency development as well as in research and development. This is one system that focuses on nursing care. Normally, systems like this would focus on medical diagnosis and medical focuses or made by technicians and engineers, but this is solely made by nurses on all levels, both on the content side as well as on the technology side. And we have been working on the technology side with integrations with quality management systems and electronic patient record systems, as well as learning platforms and skills development platforms. The aim, when this started out 23 years ago in Norway, the aim was to make nurses and nursing care visible. And the Norwegian Nurses Organization, they took ownership in the project. And that is a long time ago. So they were really pioneers in this field. The foundation for all we do and for the profession, that is our competences and skills. It is evidence-based practice that is the core of everything. However, we know that it is a lot of research out there. It's hard to get hold of it for everyone. We know only half of what we should know because it's so much going on in this area. And based on that half, we forget half of what we actually know. That is based on on the human brain and psychology knowledge from that field. And based on what we actually remember, we perform only half of that. So what is actually going on in clinical practice then? Nurses are human beings. They are working in a busy daily life. And we know that we need systems to support us with knowledge that is up to date. We need systems that support nurses and midwives to remember what to do in certain situations. And we need systems to support us to actually implement that care in clinical practice. We can't do that without e-health solutions. We need decision support tools. And that is exactly what healthcare is about. It is a continuously up-to-date content system in combination with upfront technology. And it's based and used ICMP, and now today that is SNOMED CT terms and codes. So combining these two things makes us be able to help and support nurses with knowledge, process support when it comes to the nursing process and documentation process, and also decision support. And with good quality of input, we also can make good output. We can help the patient, good outcomes, patient safety. With this, I want to not go to the questions, but I want to show you the system to demonstrate what it is. So this is the first page. As you can see, it consists of procedures, well illustrated, systematically available, and also the procedures is anchored in rationales. The rationales define the procedures. We know that nurses have challenges in describing why they are doing what they're doing in clinical practice. And to me, professionality is exactly about knowing what to do, but also why to do it. The system also has a module with mental health, which is brand new. We have calculators for nutrition and medication, knowledge tests that goes to the procedure and rationales, and some additional modules, amongst others, drug calculation, learning and practice module. The main content here or focus is the procedures or interventions that nurses are doing across the setting. You can go in two ways. You can use the search engine, or you can titrate yourself into the procedures. So if I click on the procedure, you see that the procedures are organized by basic needs, recognizable across the globe. You can, for example, go directly into elimination. And from elimination, you see the various types of procedure, for example, catheterization. And then the various types of catheterizations, for example, nephrostomy catheters, or and then we can just open one of them and have a look. The other way into the system is to search. So if I search for, I thought I had immunization here. Immunization, you see that we get the procedure vaccine and administration of vaccines. Just to use this as an example, you see that it was last updated in June 2023. The new version is coming out around the corner. So once a year, the main changes, the main content, updated content is published. This is the title of the procedure. And because this is a system that has integrations with electronic patient record systems, we keep track on the knowledge. We have a grading system that goes from 0 to 4. 3 and 4 comes with a yellow label, as you can see here, means that the performance of the procedure has changed. So even the experienced nurses see the signal, they know that they have to check out the new procedure or the changes in it. This is a description, what does grade 3 mean and what has been changed in this procedure. The foundation for all procedures in VAR is the hygienic principle, and this is an aseptic technique. And you can click on the link and go directly to that procedure if you're uncertain. But also the rest of the infection control procedures are collected in the beginning. That's because nurses need to keep track and know what is actually the hygienic foundation for this procedure before starting. The indication and desired outcome for this procedure. And in this case, we don't have any direct indications from ICN because this is a medical treatment and follow-up procedure. But you can see here also the goals in lay-term text, but also that describes the settings and more information, but also the codes and terms from ICN. I can show you another example afterwards. And then you have the execution of the procedure, step by step, the sequence, always starting with preparations and equipment, with animations and illustrations in the text. So I can just open one of them to show you. You can see that more information and more steps, and also even the rationale for the text. So this is a system that is used both by nursing students and novel nurses, as well as expert nurses. So you can choose how much information you need. You can look at the animations or illustrations parallel with the text, or you can open it in a big screen so you can see the whole. And underneath, we have the knowledge base for the rationale for the procedure with a list of references, always anchored first and foremost in the evidence-based summaries, and that is global evidence-based summaries. They could be like here, the Australian handbook, evidence-based summaries. It comes from UK, from Canada, from Norway, from Germany. Yeah, well, the countries where they have national and overall evidence-based summaries. We also found it on research articles, peer-reviewed articles, books for the traditional and practical knowledge, as well as public documents and legal documents when available. And also the procedures support the process here, so with the related procedures. So if you have a vaccine, you might also need the procedures for medication management, injections. You might need preparation of injections and infusions, etc. And all procedures also have knowledge tests, 5 random questions coming up to support you for learning, lifelong learning, based on the changes internationally. And when you do a mistake, you have to find the answer, and that could be a procedure, or it could be a knowledge summary like here. Also, the knowledge summaries have the last update dates with references in text and the list of references for this content. Another option is that you can search for procedures that you know that you need, but you can also search for a certain situation based on ICMP/normal CT. So, for example, you have a patient that is bothered with dizziness. And then you see, I have a nursing diagnosis down here, dizziness. When you click on dizziness as a diagnosis, you get suggestions for what procedures might be actual in this case. It could be fall risk assessments and fall risk preventions, depending on whether the patient is at home or in institution. You might need to consider to assess and prevent dehydration. It might be that you need to measure the blood pressure, also blood glucose measurement and pulse measurement, and also early detection and response to patient deterioration. So based on just one search, you get reminders of procedures or interventions that might be used in this situation, helps the nurses to remember what to do. How am I with time, Karen?
Yeah, your time is up, so just try to conclude.
Yeah, so this is a system to be used across the settings. We try to collect both and make the evidence research available for users in practice and to understand for everyone who works in the nursing care area. And also we are collecting and in tight contact with the users across the countries, across the settings, and we collect experience-based practical knowledge across these settings. And that is a valuable source that I haven't seen in any other systems before. And it's so interesting that we could join the forces of nurses, join the knowledges that we have into a system that can support us to perform high quality practice and education. So thank you.
And thank you, Ann-Kristin Rotegård. This was a marvelous presentation, and you already got the question in the chat from Dorota Kilanska, if this could be implemented internationally. And of course, we know that you are working on that. So
yeah, it is already implemented in the German-speaking countries with a German-speaking version. We have an English version where we have a pilot in Canada, and we're looking for also partners in UK with processes there. So the English version will be available wherever. So just contact me.
Very good. Thank you so much. And good luck on spreading the word about this this tool. It really is a marvelous tool for to guide nursing practice and to strengthen nurses and midwives in clinical practice. So thank you so much.
Thank you as well.
Very exciting. So now we are, according to the schedule, we should have Zhao Gentil, who is a nurse manager, next, but Zhao hasn't arrived yet. So we will move on, and we will move on to the next presentation, which will be held in Russian. So all English speakers, if you have not pressed the globe at the bottom of your page, do so and choose English so that you do get the interpretation from the Russian into English. And Natalia Serebrennakova has also helped put some English into the presentation itself. So that should also help us to understand the next presentation. Rixi Zalikovjaeva is the Chief Nursing Officer and the Uzbekistani Ministry of Health, and she's also president of the Uzbekistani Nurses Association. I should have practiced saying Uzbekistani. Sorry about that. She will speak now about the role of nurses in digital health and what kind of extra support nurses need to work with digital health. Rixi, please. And Christine, could you take down your presentation? And I will be helping Rixi with her presentation. So we'll see how I do here. Am I sharing now? Oh, okay. And let me see.
Спасибо, Карин, огромное вам. Я очень благодарна организаторам сегодняшней нашей вебинара. Мне очень
truly thankful to the organizers of today's webinar. I'm very happy to see all our colleagues. I would say that we have acquired quite a lot of advanced practices and experience in digital health, thanks to Maggie Lengins and other colleagues. I would like to speak about the role of nurses in digital health. And as you can see here, next slide, please. So actually, nurses and midwives play an important role in the health system, not only in delivering emergency care, but in terms of continuous professional development and also delivering high quality and effective accessible services to all in need. We try to stick to the Munich Declaration and other declarations whatsoever. And Maggie has just mentioned about our action plan for the Central Asian region. And we have a borrowed basic ideas shared by the World Health Organization. In the next slide, please. I would like to speak about the training of nurses. As you can see, we do it at 3 different levels. These are medical colleges and technical schools, and this is a higher nursing education. It takes at least 4 years. And we also have the master's degree, the PhD. We have the Academy of Nursing Science. So we also train nurses to be leaders. We train nurses in major referral centers and also clinics. And on the next slide, I would like to speak about the supply of nurses. As you can see from this slide, as for density of nurses and midwives, it makes up 98%. And well, as compared to the European countries, in Uzbekistan, we have enough supply of nurses, and we also provided them with the relevant posts and vacancies. And on the next slide, so we have undertaken a reform in the primary healthcare. Next slide, please. And next slide, please. Yes. Yeah. Oh, please. One more. One slide back. One slide back. So could you return 2 more slides back? Yeah, here it is. So as for the supply of nurses, so a major reform is being underway in the primary healthcare system, but every year we add additional posts of nurses. And the provision of primary healthcare physicians also makes up 99%. So 10,000 nurses. These are the official posts, a head count of nurses, official posts. And next slide, please. So as you can see, so we have a system of electronic documentation and electronic system. For this purpose, we have developed a specific platform, and a number of nurses were trained in the computer technologies. And we have, all in all, 8,000 nurses in this system, and they work in different healthcare facilities. And on the next slide, so here is the digital health. So we have a digital polyclinic, outpatient clinic. Here we provide for the automatic data registration, maintenance of a unified electronic outpatient medical record, family and polyclinics, and we also have e-documentation. So we also have a practicing nurses. We have also developed electronic documentation. These are the nursing records in the primary healthcare system. So a nurse practitioner would see a patient, they would fill out an electronic form. So we have a non-clinical office, and nurse, such a nurse has a separate office. So the nurse would undertake the screening and also diagnosis, and then she would refer all the data recorded by a nurse further to the physicians. So we have a Technomed electronic documentation, the case records with the test findings, lab test findings. So all these records are maintained in the in silico, in electronic form. And next slide, please. Time is running. Next slide. Next slide, please.
I'm having difficulty advancing the slide. There. Oh.
So as I have already mentioned, so we have the health care teams. We also have home visiting nurses. These are both nurses and midwives. So home visiting nurses and midwives. So this is a single team, and they work in the prime healthcare system. Next slide, please. So here you can see the offices where the nurse would see a patient. She would refer the patients to the lab tests. She would also perform screening and do the workup. She would see to patient health and prophylaxis. Then a nurse might refer patient to the lab or to the doctor's office, depending on the need. Next slide, please.
I'm having a challenge to advance the slide.
Пожалуйста.
Does anyone
Yes,
have a suggestion on how
please do. Может быть.
I'll have to stop sharing and try and reshare. I don't know what I can do. I'm sorry.
Technology is always a challenge, Karen. Do not worry. It looks like it's all blank on the bottom of where you can move the slides. So
yeah, it's very difficult for me. But I think your time was up anyway, Rixie. Is someone
here you are. We can see, yeah, we can see the next slide.
Very good, very good. You can continue.
Следующий слайд. Можно следующий слайд быстрее, я быстро скажу. 2 минуты.
Okay, maybe you just moved to the next slide, please. I will comment the next one. Yes. We have developed the universal model, and a nurse is entitled using this mobile application to main contacts with her patients, pregnant women, and also other women with children under 5. Through this mobile application, she may share a good piece of advice. And next slide, please. We have also developed the mobile application. It's a mobile application. It's all about caring for and nursing for children, their health, early education, safety, and optimal nutrition. So a nurse, through using the mobile application, she may give good piece of advice, and we can also organize home visits this way. And next slide, please. And in the next slide, so I have already mentioned this. This application is called Bebo. So using the mobile application, every mother may receive at least 10 advice from caring for caring patients. There are also games for children. So also breastfeeding as safety and health and well-being, and also parental well-being. Next slide, please.
Rixie, your time is up now, so you must conclude, please.
As you can see from here, the nurses mainly work and operate these mobile applications. And next slide, please. Next slide. Just move them. So there is also a mobile application for nurses, for midwives, sorry. And we also have a program of non-infectious diseases. And next slide. So they developed the individual patient management plan. And next slide, we can see that these are mainly the WHO recommendations for non-communicable diseases in the primary healthcare system. And next slide, please. So here is the individual patient care plan. It is also kept in the electronic form, and the nurse and the patient may maintain electronic communication. That's all probably. And the last slide, with your permission, I would like to congratulate all women with the International Women's Day. Thank you very much for your attention.
And thank you so much, Rixi. We really do need to understand more about what is happening in the area of digital health in the eastern part of our vast WHO European region. So, and we're very proud that you as a nurse and the chief nurse of Uzbekistan in the ministry probably have a lot of influence on the development of these digital tools for nurses and midwives in your country. So thank you very much for representing nursing and midwifery in your country. And we wish you the best of luck. And you've just shown us that we need to know more about Uzbekistan and the rest of the eastern part of our region. Thank you very much. We are going to move on now. One of our presenters, João Gentil, has not arrived yet, and so we will just continue. And then if he does come, if not, then he has sent me a recorded message that we can present. Our next presenter is not Leah Jochman from ENSA, the European Nursing, Early Career Nursing and Nursing Student Association. We have with us Tim Mitnick, who is the Director of European Affairs within the Association for Students and Early Career Nurses. And he is going to have a presentation now that I'm really looking forward to. It's called Is Nursing and Midwifery Education in Europe Ready for the Digitally Competent, I put X generation, but it's really the Z generation that we're going to be hearing about. So I'm going to give the floor to Tim Mitnick. Go ahead, Tim.
Hi, everyone. I'm glad to be here. I just want to say sorry in the name of Leah. She was really excited to talk with you as a first appearance online, but unfortunately she is stuck at work. We are now in our placement time and she is just in an emergency in the hospital, so I will take over. I want 2 seconds because we have the stage. I want to say something in Russian to our Russian-speaking audience and people. Здравствуйте всем. Я очень рад вас всех видеть тут. И мы в студенческой организации хотим очень с вами поговорить и студентов в наших проектах пригласить. So, если вы хотите, я напишу вас мой имейл, и, пожалуйста, мы можем поговорить, потому что мы хотим с вашими студентами много говорить и увидеть, что у вас такое. Thank you. I'm invited the students from this country to be more active in ENSA, and I want them to contact us. That's all. I just wanted to use this platform. But now to the subject. So when we were presented with this question at ENSA, when Karen helped us to find the question is nursing and midwifery education in Europe ready for digitally competent X generation? It was Z generation, but we couldn't find a good answer. It's yes and no. And when we came to see why it's yes and no, we contact our local student organization all over Europe, and we asked them a couple of questions. And I want to present you the results of our question and our small focus group. Why is education is really important for us, and how we can cooperate with digital technologies in the education. I will share my presentation now. One moment. Can you see the presentation? So,
yes.
Thank you. So, what is the Z generation? Because a lot of people, a bit me, I was also confused, Z, X, Y. So the Z generation is those born between 95 and 10. And what's important about this generation, they are now entering the nursing and midwifery workforce in large numbers. They are or starting university or just finishing university and going to the work field. And it's important to know what we expect, what we want, what this generation need in the education to be successful. And that's the question that we ask. So what are the characteristics of this generation? We ask our focus group, how do you describe yourself? And we put it in some groups. So Gen Z are digital natives who grown up with technology like smartphone, tablets, and social media. I can give it in context of nursing. Someone told us that for him to put the phone in the scrubs and just have all the information on his phone that he needs to calculate everything on his iPhone will be much better than working with the station computer all over the world. Pragmatic, and like they told us, and we noted that like we want like learning that will be much adaptive at work. We want to know what we can do and how we can apply it in our work, and not like a lot of theories and so. The theories have their place, but we want more on-hand work. Entrepreneurial, it was a deficit that we found, that nursing students and like early career nurses that are working in the wards, working with patients, have always digital solution ideas. They want like they have ideas how can things will be better, but they don't have the skills to develop these entrepreneurial issues, like how we record a patent, how we can open a startup. And that's something that actually ends up working actively. We are involved in research and creating a curriculum for entrepreneurial skills in nursing. And social justice, our students told us that for them it's really important like to make a difference in the world, and they use the technology and the digital world to do it. What are the challenges that we found out? So attracting and retaining talent. For education, a lot of student nurses say that they really, really would like to teach and give their knowledge of technology to other students in nursing after they graduate, but there is not enough, or there is the ability to get a job in a nursing school as a teacher for technology or something like this. It's really, really, really difficult, and they would like more to be involved in teaching technology to nursing school directly after graduating. Updating the curricula in teaching methods. We found out that the curricula is really different in different countries around Europe, and the students that we talked with were like a bit confused about why in this country it's more technological and more involved online, and we need to come and listen to lectures. Also something that we found out that the teachers, because the migration and like a lot of how you say it, diverse classes are present now in nursing schools, and like from backgrounds like older people that are taking as a second career nursing, and younger people that going directly from school to nursing school. So it's difficult for them to see who is more digitally native or not. Something that we found out also, that nursing students are aware that a lot of nursing schools have not enough finance to bring more technologies in school, to give more technological opportunities to people that's studying. So that's something in financing the technologies in schools, and balancing demand on time. A lot of students say that their teachers, their professor, they feel that they are involved in so many things that they don't give them enough time or the enough time and enough attention that they need for them to serve their concerns. And they said that maybe digital solution could help in this, to fill this gap, like online speaking time or online platform that they could put their concerns and their professor can answer on their free time. We ask the students, how would you like to be taught in school? So I have to say that everybody in the COVID time said that it was really good to have online, but they don't miss it. So it's a bit problematic because we couldn't have an answer. As I said in the beginning, it's yes and no. Like everybody enjoyed the online, but they also enjoyed coming to school. But they say when we are in school, we want something different. So they want like active learning techniques. They want to reduce lecture time and have more together work and more interactive thing, more small group discussion. That's something that we were surprised that students want more to discuss and have this professional discussion with their colleagues. And of course, the increased use of technology. They said that there is not enough technology in school. So incorporating technology in the education, it's something that ENSA is now in mission. In the next couple of years, we will promote incorporating technology into the curricula and to give hands-on experience. I will tell something that we got in our questionnaire, like the example of nursing records in nursing schools. People need to write nursing plans in hand and do everything like nursing records when they work on patients in school. They need to write everything, but then they come to the hospital and everything is digital and there are different programs. So they would like to have the use of more technology and computers in school to learn how to do it digitally directly and not to write it like 10 years ago or 20 years ago. Something again that we ask about technology, our students, it's the assessment and how they want to be assessed in school. So 73% of the people that answer said that they want presentation, the 76 project and group work. So we see that people prefer use technology to be assessed. We ask also about digital exams and they say it's okay, but it's too complicated because it's always have a problem and it's not, we got an answer that they have problems all the time with digital exams, that something happened and then nobody knows how it will be and then they need to retake it. So exams were low, and so we see that using presentation and digital methods to do assessments in nursing school are much more preferred. And again, something really interesting that we find out that although a lot of people say that our generation wants only technology also, but we want to go hand in hand groups, this social interaction and also technology together, like incorporating technology in school, in nursing labs, in simulation labs, and work in groups in this, and not to sit alone at home in front of the computer. So The first takeaway from my presentation is the Z generation prefers active learning. The second takeaway, that Z generation values technology. We value technology and we want it to be incorporated in everything. But as I said before, it's supposed to be together with human interaction. And of course, everybody says work-life balance, that school should not be from 8 o'clock in the morning till 5 o'clock in the afternoon, like incorporating digital solution to the curriculum so people can learn in their own pace at home when they want. It's much more preferred to them. So I hope I could manage answering your the question that was presented to Enza, and that's it for my side. If you have a question, I'm here.
Thank you very much, Tim. This was a marvelous presentation, and it's really a message that we really need to send out to all of Europe. And you showed that there is wide variation across educational settings. And I think one of the key messages too from your presentation is that we have a huge nursing crisis and midwifery crisis when it comes to nursing and midwifery shortage across Europe and across the world. And attractive education is critical. The attractiveness of our clinical settings in hospitals and community health settings is actually quite critical if we want to attract and retain nurses and midwives in the future. So I think the message that you gave was loud and clear, and I hope that you publish this study, because I think we need to hear what Generation Z really thinks about what they're getting into in the nursing profession and midwifery profession. So thank you very much. We're going to move on now. Our presenter, Joe, is still not here, so it's possible that we will have to postpone his presentation until a later webinar. But we do have one more presenter, and I'm really happy to present. As we heard from Jillian Janes, the area of jobs was the area that was least represented in her in the literature review that the GNLI scholars conducted. And so the area of jobs is really something that we need to increase our focus on. And luckily, we were able to locate a project that's getting started now. I think it's just getting started. And it's called the EU Pact for Skills and Be Well. Invest in nurses and secure success when digitizing the healthcare sector. And it's Dr. Paul Derev, Professor Dr. Paul Derev, who's going to present. He is the Secretary General, of the European Federation of Nurses Associations, which is one of the partners of our webinar today. So Paul, I will just hand the floor over to you.
Thank you so much, Karen. In the meantime, I loaded already up the PPT, and so that everybody can follow, to say that the European Federation of Nurses was established in 1971 with the aim of influencing and writing EU legislation that impacts nurses and nursing. This is our main objective. This is my main job, to influence the European Commission, to influence the European Parliament and the Council of Ministers. And it is within that context that I will give you this presentation. The EFN represents 35 countries, 36 NNAs, and most of the members I saw in the list are present, so I say hello to everybody. The EFN members will know all this because they are regularly briefed in the General Assemblies of EFN. For the audience that is not familiar with EFN, I can say that the priorities are very limited. First of all, the education is very important for EFN with the Mobility of Nurses Directive 2030-55, Article 31, and this is key for the EFN members. Secondly, the EU Workforce for Health is key for the EFN members and is a top legislative priority for EFN. To conclude, the third priority is quality and safety, including the digitalization. So the conclusion of this slide is a very small set of priorities impact with the European Commission and the European politicians. That is what we need to do. As you can see, here is the Berlaymont building behind, where the Commission is writing EU legislation. And I can give you a list of legislation that EFN has co-designed with the European Commission, and all these legislations listed are impacting frontline nurses. There was quite recently a new directive that EFN members supported very significantly, and it is the proportionality directive. But last legislation mentioned on this slide is the mutual recognition of professional qualifications and the delegated act that is now in process in the European Commission on Annex 5. These are all legislative contexts that member states need to implement, and if governments are not doing that, the European Commission will bring the member states to court. So we are not working on recommendations that member states can put aside. We are working on EU law that the Commission will hold the responsible countries responsible. And as you can see, here is Ursula von der Leyen. She is a physician herself, a public health physician, and she stressed the importance of mutual recognition of professional qualifications of the nurses and the physicians, because she understands that the biggest group in the healthcare workforce are nurses and doctors. And this has a huge impact, of course, on what we do. If your group, like the pharmacist, is 400,000, it is much easier to manage. But if your group is 6 million nurses in the EU, then it is more difficult. And that makes it clear that the EFN has, together with the European Commission, responsible for employment, launched a few years ago the Pact for Skills. We see that especially on digital skills, but also on green skills, the nursing community has not the skills that we need to face the future challenges. And so in that sense, the European Commission has launched this initiative, and you see on the right side the note where the EFN president, but also the president of the doctors, the European doctors, but also the Commissioner Kyriakides and Commissioner Breton and Commissioner Smith were all in that meeting. So what I want to say, we are at the highest political level to influence the outcome of these networks and the outcomes of the Pact for Skills. Of course, when you develop a political project, there is always something that links to the money and the European projects. And this is why EFN is in this big project of Be Well, which is a blueprint alliance for a future health workforce strategy on digital and green skills. And it is specifically how can we upgrade the 3 million nurses in the EU so that we are coming in 2030 closer to that level that we want to achieve. And Commissioner von der Leyen has allocated out of the billions of euros available to the member states in the European Recovery and Resilience Funds, which is a pot of billions of euros, and she has specifically made criteria into this. When she gives money to Germany or to France or to Croatia, she said you need to use 20% of these funds to digitalization, and especially the healthcare sector. So We need to bring the money to the frontline nurses, because developing ideas and more ideas and more ideas, but no money to do it, it's a waste of our time. So we need to make sure that the money follows what the Commission is doing, and EFN tries to put that forward. Of course, my dear colleagues, it is not only about the Pact for Skills. Currently in the European Parliament, we are discussing in trialogue meetings the European health data space. That is your electronic health record of every single citizen. And here we are discussing politically with the three institutions, how will this look like? And in this EHDS, you have a particular article related to opt-in and opt-out. And EFN, together with CPME and together with the pharmacists, we are working closely to influence the European legislation development. So this will come out by the end of June, I think. Politicians will agree in the parliament. And so then member states have 2 more years to implement this new legislation. There is also new legislation on artificial intelligence, and that will need all to go to practice. So in the coming 5 years, we will have opportunities to put flesh on the bones. Let me then go back to this Be Well project, where EFN is a key partner in developing this blueprint and the development of pilot projects on digital skills and green skills with nurses. It's a 4-year project, and we are half through for the 2nd year, and it's up to 2026. So these skills are very practical oriented. If I'm a nurse in a unit in intensive care, we will measure where are you with your skills in relation to different digital opportunities, and where do we want to achieve, and that pathway will be designed for the nurses and the doctors and the midwives and the physiotherapists, and the patients are also involved in that, because health literacy is still a very difficult issue. I'm going, Karen, almost to the end, but I want to re-emphasize the directive on mutual recognition of professional qualifications. And I can assure you that all EFN members present in this webinar understand this directive 55, because many of them are fighting at national level because governments want to downgrade the nursing education. And so in that sense, currently we are modernizing on a delegated act, the Annex 5, where we have the 8 competencies listed in this article, and we are the only sectorial profession with 8 competencies in EU law. And digitalization is linked to all these 8 competences. So legally, we can ask member states to implement more digital skills into the nursing workforce and other workforces of the health workforce. And here you will see that Annex 5, where the Commission is adding to the legal text the word strengthening evidence-based nursing. Look at the second point, digitalization skills to boost continuity of care. It is in EU legislation, and we can hold governments accountable for doing nothing. So that is quite important. Of course, here the mentorship for the students is key, the multidisciplinarity. And this comes all back. We all know that we will go to ballot points in June, from 6 to 9 June, and we are all scared about these elections in the European Union because we see a tendency of political change. But that means that the governments want to finish now quick negotiations with the Commission because they are afraid of what is coming to us. And here EFN members have decided very clearly, if 3 million nurses vote on the 6th of June We hope that they vote, bringing people, 900 MEPs, to the European Parliament, and make sure that they support nurses, that they support healthcare, and that they support at least health. And we have asked, as EFN members, we ask the politician, invest in education, invest in the directive on mutual recognition. Do not throw the baby away with the bathwater, because you will kill the nursing profession education. Safe staffing levels are crucial. EFN members want to have the safe staffing levels included in legislation. Better wages. We need to make sure that the nurses in the EU, at least for our region, can have better salaries, because it is an important criteria for staying in the profession. Why should you risk your own life for €1,000 a month netto? So, and then the members also agreed that it is important to focus on nursing management. Karen, I close here with a picture of the EFN members in Opatija in Croatia. I thank you very much for giving EFN the floor, and I look forward working with you all on this future endeavor. Thank you very much, Karen. You're unmuted, Karen.
I thought I wasn't. Okay, thank you very much, Paul. This was a very energetic appeal to all of us. I don't have the voting rights, of course, in the European Parliament, but many of those who are here today do. And so I think that your appeal was probably heard by everyone who has voting rights in the European Union. So thank you so much. And thank you for making us aware of what's on the ballot. We've been wondering what's happening with the annex. Of course, it's been on the agenda for some time, but they didn't move to really adjust it. So it was quite aged. So it's really exciting to see that they are now focusing on evidence-based practice and digitization in the nursing profession, among other things, of course, that you mentioned in your talk. So thank you very much, Paul, for this very insightful presentation. And let's hope that everyone has heard your clear message of what we need to do at the ballot in June. Thank you very much. Dear colleagues, we now have 13 minutes left of the webinar. And so what I think we will do is to move on and look at some key messages. I developed them actually before the webinar because I knew that it would be difficult to multitask and do that along the way here. And of course, I do have my co-moderator. So Rolf Andre, if you want to come in and make any comments on this list that I'm going to show, you just go right ahead. And I'm just going to share my screen and hopefully it will show up here. So what I've done, I've tried to, consider some of the messages that we've received today and that were sent in ahead of time. And what are the key messages of this webinar? Well, I think number one is that nurses and midwives must be engaged early in the policy development process. And I think we saw that, or we heard that very loudly and very clearly. And we experienced that when the GNLI scholars went to Copenhagen, met with Clayton Hamilton, and brought the message of what nurses can contribute to the regional action plan on digital health. That was really an important activity that they were able to perhaps teach, present what nurses can contribute to digital health. And so I think it became a much better document due to their intervention, and that happened before or during the time when the document was being developed. And I think we heard that also from Paul Durev in his presentation, that nurses have to be active in advocacy with the European Union as well, when it comes to having influence, having impact on the decisions that are made at the European Union. And of course, we know that the European Union and the World Health Organization do work together, especially when it comes to the area of digital health. So those were two presentations really that reinforce that first key message there. The second one I'd like to bring up is that national nurses associations and national midwives associations really need to be aware of WHO policies, and I should have added, and EU policies as they're being developed, because they do have a strong impact on our professions, and they need to actively utilize those policies, those WHO policies, when they go back to their national governments. Because what happens at the European level, what happens at the international level, has an impact on the national level. And so all of the documents that we've heard about today are policies, contain policies that national governments must implement, whether we're talking about the European directive or we're talking about the digital health action plan that's been put forward by the World Health Organization in Europe. So that's an important thing that we hope that all of the national nurses associations and national midwives associations that are present here today will heed the message and bring the knowledge that we've gained today, use that in advocacy with their national governments. The third message I think that's really quite important here is that we need more research. This is needed to ensure that digital solutions in nursing and midwifery are evidence-based. The fourth key message, nurses and midwives must have digital evidence-based decision support programs to support their work as clinicians, as leaders, as managers, regardless of what position they hold, or even as educators. They need to have that digital decision support systems in place. So this would be an important area for investment in the area of digital health. Standardized language for nursing and midwifery is critical to create information on the impact of nursing and midwifery outcomes. Of the impact of nursing and midwifery on outcomes, it should have been here. So let's think about that, because the presentation that Ann-Christine Rutegård held for us emphasized the importance of having the International Classification of Nursing Practice integrated in the evidence-based decision support system and the clinical guidelines that they have produced through this VAR healthcare system. So I think that's very important for us to know. And in order to create information that can be used in our advocacy work, we need to be able to aggregate data from the bedside to the management level, up to the government level in each country. And then also let's start considering being able to create big data to compare nursing practice across the European Union, across the World Health Organization in Europe. Standardized language, yeah, I mentioned that one. And the second to the last one here, nursing and midwifery education must integrate digital health tools in all areas of education. Whether we're talking about nurses working in the laboratory and with digital programs, or whether they're in clinical practice, they need to be exposed to the digital health tools in all areas of their educational experience. And these must be updated to the needs of our Generation Z. Okay, and then the last one, digital support is important to increase the attractiveness of working in the health sector. The health sector has lagged far behind the rest of society and other industries and sectors in our societies. And now it's really time for the health sector to move forward and to start implementing or to carry forward more modern digital health tools that we can use in our exercise of nursing care, nursing practice, nursing education, and nursing management leadership. So these are a number of key messages, and perhaps what you got out of today's webinar may be completely different from what I've listed here, but I think that these are important. I don't know, Rofunde, do you have anything that you would like to add to the list? You're on mute.
No, I think you summed it up really nicely. It's quite close to my notes because I was jotting them down. So I concur as it.
Okay, very good then. That's wonderful. And now I wonder if our FNMA president is still with us.
Yes,
Maria,
I'm still here.
there?
Yes,
would you
Karen,
like
I'm
to conclude and maybe mention the next webinar that's going to be held on the 7th of May? Go ahead.
I thank you so much, everyone, joining us today. And as usual, it's really enjoyable webinars when we share so much information and actually see the pattern of issues that cross over, especially in this webinar, all the different sectors that we cover within the strategic directions for nurses and midwives across not only globally, but especially in the European region. So thank you again for all our great presenters. So much information was gathered. Now, yes, I would like to mention, we have started a special week during May, which starts on the 5th of May, the International Day of Midwives, and finishes on the 12th of May, the International Day of Nurses. And during this week, we usually have a lot of information or try to get activities and engagement from our associations and good examples what is happening in their countries. And also we include a webinar, another webinar, which this year will be on the 7th of May during the week. And it will be focusing on the primary care, our role in primary care. And I think we had a very good example from Rixi today of actually what nurses and midwives can do. We have an issue in the European region. Because I'm a midwife by profession, have been a nurse, but where the midwifery had more strongly as a longer service on that. And we find that the midwives, for example, are not engaged in a primary care at all. And it's obviously apparent that our eastern section of European region are doing a great advancement of how they utilize nurses and midwives in a primary care. But we must make sure that they are not there just to replace the medical personnel that might be lacking. And also, like Paul mentioned, they compensated for the work that they do, which means that their wages have to be relevant for the roles and the competencies that they undertake to deliver the service delivery. So I hope you will be all enthused to join us on the 7th of March. May. Yes, I know. March in my head. It must be the spring madness that is coming along. So 7th of May, and do keep eye on because we will be advertising it in Twitter X, if I get used to saying that. And also, please, if you have any stories or case studies or anything that you would like to highlight through the FNMA website, we would be really pleased to receive as regarding what is happening to you during either the International Day of Midwife or International Day of the Nurses. And thank you, Karen, very much for, again, such an excellent moderating. It's always a pleasure to hand the reins to you and just sit back and enjoy all the speakers. And that's it. Goodbye.
Thanks, everyone. Bye. Thanks for your contributions.
Thank you very much.
Bye, everyone.
Bye.
Bye.